All right, so you're turning 65 this year and you get the notification from Medicare that your Medicare Part A and Medicare Part B will start on your birth month. And you're also going to start getting a bill for at least $174.70 a month for that enrollment. I mean, that's a lot, right? And you think to yourself, do I really need to get Medicare? Will it be a problem if I don't enroll in Medicare? Is it even possible to get something that is less expensive? And these are all really great questions. And today we're going to talk about if you must get Medicare, if you should get Medicare, and how to get help paying for it if it's just too darn expensive. Now, this is Michael's Medicare, where we talk about all things Medicare, from plans to benefits to enrollment periods to extra help, prescription drug coverage, Medigap, and the whole kit and caboodle that is Medicare. But before we get to it, don't forget to like and subscribe, because it'll help to keep you up to date about the newest Medicare changes, newest Medicare options, and ways to make more, better informed Medicare decisions. So, here we go. So let's tackle the big question first. Do you have to enroll in Medicare? And the answer to that is obviously no. In the same way, you don't have to pay your taxes and you don't have to go the speed limit, and it is a very important but, you definitely should, in most cases, enroll in Medicare, because there could be a lot of penalties for not doing so. Now, I know it's tempting. We have the occasional client who says, why should I enroll in Medicare? It's expensive, and the Medicare monthly premium at $174.70, plus the cost for prescription drug coverage Part D, plus the costs that are paid when you go to the doctor and the hospital, and you pay the copays and the out-of-pocket maximums and all that put together. That does truly add up, but it becomes less of a hindrance when you think about what are the alternatives. What happens if something bad happens, you get sick or you get injured and you don't have any coverage? Now, before we get into all the gloomies, let's set that aside and also talk about the potential penalties for not enrolling in Medicare. Keep in mind, there are penalties for not enrolling in a Medicare plan when someone is initially eligible to do so. So, for example, if you turn 65 and become first eligible for Medicare Part A and Part B, but you decide, you know what, you don't need Medicare Part B, which is the portion that covers doctor's visits, lab works, x-rays, the normal day-to-day types of usage, there actually is a penalty for not enrolling when you initially can. Now, this is the moment where I want to stop and talk about you and your friends. And you may have friends who say, oh, you know what, you don't need Medicare Part B, you're perfectly healthy. Or maybe it's a family member, a cousin, a brother, an uncle who says, you know what, Medicare Part B isn't necessary because you can always get it later. In most cases, this is bad advice. Let me tell you why. Because first, there is that Medicare Part B penalty, which is a penalty that Medicare applies to your Medicare Part B premium for enrolling late, if you forego enrolling and then later enroll at a later point in time. And the costs are pretty steep. The Medicare Part B penalty essentially will add an additional 10% of cost to your Medicare Part B premium per year that you could have been enrolled, but you didn't. To put numbers on that, if you turned 65 2 years ago and could have enrolled in Medicare Part B, but didn't because of the cost, well, that'll mean that if you do enroll, because now your health situation has changed and you have to use the health coverage to see your doctors, they're going to charge you an additional 20% more every single month. In 2024, with the Medicare Part B premium being $174.70, Medicare would add an additional $34.94 on top of that per month, bringing your monthly Medicare Part B premium, just to have the coverage, not to use it, to $209.64. And yes, that is bad, but the worst part about it is that the 20% applies in perpetuity for the remainder of the time that you are on Medicare. So year over year, decade over decade, you're paying an additional 20% for your coverage, and that really adds up. I mean, it's basically like giving Medicare a 20% gratuity for their services every single year, just because you decided to delay enrolling. Penalties aside, the other reason you may want to consider enrolling into Medicare Part B is because, except for in specific cases, once you decline Medicare, you will not be able to re-enroll, like if you actually need to use the coverage, until the general election period, or the GEP, which only happens once every single year from January through March. So if someone has a heart attack, for example, in May, and they didn't enroll in Medicare but wants to get the full coverage back to cover their bills, Well, that won't be possible until the following year during the GEP, leaving them with tens, if not hundreds of thousands of dollars in medical bills. And the last reason for today, talking about why it's important to stay enrolled in both Medicare Part A and Part B, is because without both parts, folks are not eligible to enroll in things like a Medicare health plan, a Medicare Advantage plan, a Medicare Part C plan, or a Medigap plan that offers that additional coverage and added benefits, etc., because they don't have both Part A and Part B. You have to have both to get those types of plans. Because if someone does have a heart attack, you know what? They really are going to need all the support that they can definitely get, and also not get left with a huge, huge bill. Now, that being said, there are times when you may not need to enroll in Medicare, and they are quite few, or even have to pay that Medicare Part B premium. The main reason for this would be if someone has health coverage that is credible. Now, credible means equally good or better than what is being offered by Medicare. This could be credible coverage offered through work or a union, or maybe through a spouse's employer. But as long as the cover is equally good or better, and if you talk to your HR person or the HR person there or the person administrating the benefits, they will know if it is credible or not, then you actually can delay getting Medicare until that source of coverage ends. Better yet, when that coverage does end, a beneficiary wouldn't actually have to wait till that GEP period to be able to jump right into a Medicare plan, because once they lose their credible coverage, they will be able to do so at any time throughout the year. So this is probably one of the only real reasonable situations where someone could opt out of having a Medicare Part B plan, at least for the time being, and avoid paying that coverage. Also keep in mind that alternative health insurance options that are available prior to 65 years old may not be viable options or less expensive options once you are already 65. So once you become eligible for Medicare, some of those other options aren't even going to be available for you. So for example, here in California, we have the Obamacare plan or the Covered California plan or the healthcare exchange plans, healthcare.gov, as it is through most of the rest of the country. There are plans that have $0 a month premiums and have great benefits and great doctors. So we have lots of clients who say, oh, I just want to stay with my healthcare.gov plan. But once someone is eligible for Medicare, then they will not be able to enroll into these plans, at least with the financial assistance from the health exchange, which means that those plans they can keep, but they are going to be buku bucks. And situations like that would be a situation where if you're trying to compare the two, maybe you would want to talk to a professional, or at least look at it very, very careful, because it can be kind of messy and kind of complex. All right, so to summarize up today for the question, does someone have to get Medicare if they're eligible for it? The answer, of course, is no, with the caveat that in most cases, it is probably a good idea because it ensures that a person has coverage in the case of major health issues or accidents. It avoids any potential lifelong late enrollment penalties that themselves could cost hundreds, if not thousands of dollars needlessly over a lifetime. And also having a Medicare Part A and Part B is the gateway to getting more coverage and additional benefits through Medicare supplement plans, Medigap plans, Medicare Advantage plans, Medicare Part C plans, MAPDs, and all the like. Of course, all these things can be put on hold if someone does have credible coverage through an employer, a sponsor plan, a school, a union, or somewhere else like that, maybe the TRICARE, veterans benefits. But that would really be the only time it would be responsible to opt out of Medicare. All right, so that's it for today for Michael's Medicare. And if you have additional questions or you want to get more information about your specific situation, feel free to reach out to us at the information down below in the comments, or leave a comment, or give us a call, or check out the other great videos on our socials, on the YouTube and the Instagram. New content every week. So for Michael's Medicare, I'm Michael, hoping you have a great rest of your day, and goodbye.